A trip to the grocery store is filled with decisions, and navigating a nutrition table isn't always easy. But on January 1st, new front-of-package labeling became mandatory, giving consumers more information at a glance. It highlights foods that have more than 15% of the daily recommended value of saturated fats, sugar, or sodium. But with obesity and diabetes rates skyrocketing and a healthcare system in crisis, the reviews are mixed on whether these warning labels go far enough.
8 grams of fiber and 12 grams of protein per portion.
Nicole Boyd knows what she's looking for. As a registered dietitian, she often helps clients understand food labeling. She says Health Canada's new packaging requirements are a step in the right direction.
I think it's a positive thing. I think instead of having to turn the label over and looking at all these numbers, it just gives you a really quick idea of whether it has those ingredients in it.
Consuming too much saturated fat, sugar, or sodium can increase the risk of stroke, obesity, heart disease, type 2 diabetes, high blood pressure, and some types of cancers. But the food industry doesn't necessarily care about that.
And their profits are the most important thing for those companies. And what we know is that it's unlikely to come from voluntary actions from the food industry, and it is government who is going to have to act, likely to change those behaviors.
Everyone's heading to McDonald land.
Vanderlee says other health policies are being discussed, such as banning the marketing of unhealthy foods to kids, but they're running up against food industry interference and lobbying.
So when we think about making choices, we're making choices within an environment that's been created for us by some very powerful actors who are very driven by profit. They're not necessarily thinking about our health.
Customers at the co-op in Fredericton agreed the new labeling is a good start.
It is nice to be on the front of the label so you see it right away, but I think most of the people buy what they're used to buying, and they may not even see that, but if it helps a little bit of people, then it's good.
I've yet to see one that is not illustrated as being high and just part way along the scale, so I think that if they can have a graduated one, that would make more sense and certainly help in the decision-making process.
As a retired nurse, I worry about obesity and the levels of diabetes and all of those things that are happening to people, but it could go further, I think, that, and I can't even give you a suggestion of how, but we really do need to be paying more attention to our daily intake of fats and sugars.
Vanderlee says public health policies are complex, but she expects more changes to come as scientific evidence becomes more clear and consumers start demanding healthier options.